My name is Mary. I'm 62 years of age. I was 61 when I was diagnosed with breast cancer. When I found out that I had cancer, it was just such a total shock because you never think it's going to happen to you. I was diagnosed with grade 2 early stage cancer. My treatment options was that I would have to have a lumpectomy with radiotherapy. I had an appointment with Dr. Vassell. He then said to me there was this treatment that he could offer me, which was the IORT, which is a single dose of radiotherapy during the operation.
IORT, or Intraoperative Radiotherapy, is a technique where radiotherapy is given to the area in the breast where the tumor has been taken out of, and it's given at the time of surgery. And the idea is that it replaces the traditional radiotherapy that's given over a 3-week period once the patient has recovered from the surgery.
The main difference was that I was able to go in, have my operation. I knew I had that one dose of radiotherapy, and I knew once I'd been discharged from hospital I could go home. I didn't have in my mind then that, oh, now I've gone through this op and now I've got to go through 3 weeks of radiotherapy 5 days a week. I just was able to recover so much quicker.
IORT has been shown in a randomized clinical trial to be non-inferior to conventional radiotherapy. In that trial was almost 3,500 patients. And for me, that has been quite a strong proof of evidence that IORT in the correct group of patients provides just as good local control as standard radiotherapy.
Patient selection is key. The right patient for IORT is somebody who is postmenopausal, has got an early breast cancer that tends to be small, has not gone to the lymph nodes, and IORT is suitable for those.
IORT does have an advantage in that the delivery of the dose of radiation is very localized to the area of the tumour. So there is effectively protection of the breast, with the dose being very low to the rest of the breast. There is also an aim to reduce the dose to the lung, which is under the breast, and to the heart.
So when I went down to have the operation for the lumpectomy, at the same time after the surgeon had done his part, I then had the single dose of radiotherapy just on that area, so it just targeted that small area.
The main patient benefits we've seen from feedback from a lot of the patients that we've treated is that they can't believe that their radiotherapy and their surgery is completed in one session.
You know, I heard of other women having to go through all this other treatment for 3 weeks, and I just didn't have to do that. Mine was finished. I was out of hospital, I just got on with my life.
There's a real need to offer intraoperative radiotherapy to suitable patients, as over 80% of all patients, breast cancer patients diagnosed, are 50 years or older, so they may suit the selection criteria, and 4 out of 5 patients have early stage disease.
I feel so lucky that I was able to have this treatment. Very, very lucky.